Our session today is going to involve a bit of technical assistance on power mapping, sharing from each of our backbone organizations, some general updates, and a Q&A time. At this time, we're going to have brief introductions. You can just say your name and what organization you're from, and then I'm going to pass it on to Danielle. So, my name is Brianna Harper. I am from the Office of Equity and Minority Health, and which is inside our Ready office for MDHHS. I work alongside Danielle Calloway, Afton Shavers, and Brenda Jegaday, as well as Jasmine Hall. And I will turn it over to Danielle.
All right. Hi, everyone. I think we will kind of introduce the MPHI and OAMH teams, and then since everyone's going to get a couple minutes in the spotlight, kind of give that as a chance for you all to introduce your organization as well as any other folks from your team on the call. That way we have a little bit of a full agenda, and hopefully that way we can get everyone out on time or maybe even 5 minutes early. So my name is Danielle Calloway. I am now over at the Office of Equity and Minority Health. I'm the Health Equity Project Coordinator. You all have been hearing tons from me via email and phone. So I will go ahead and pass it over to Afton to introduce herself.
Good afternoon, everybody. I'm Afton Shavers. I am the grant manager in the Office of Equity and Minority Health, and I am the manager of our overall larger grant that supports this effort. And I'm going to pass it over to Brenda Jegaday.
Hi, good afternoon, everyone. Brenda Jegaday. I am in the Michigan Department of Health and Human Services, and as Brianna mentioned, the Race, Equity, and Inclusion Office. We call it Ready, and our particular area is the Office of Equity and Minority Health. I lead that area with these wonderful people who have just introduced themselves, and I will pass it on to Sharonda Grisby.
Can you guys hear me? Good afternoon,
now.
everyone. I am Sharonda Grigsby. I'm a public health consultant within the Office of Equity and Minority Health within the Race, Equity, Diversity, and Inclusion Office. And again, I work alongside of the fabulous people who have previously introduced themselves. Glad to be here today. And I don't know who I'm turning it over to.
I'll chime in.
Jasmine.
Hi, I'm Jasmine Hall. I am the epidemiologist coordinator for the Office of Equity and Minority Health. I work with this whole team, and I support data requests for the Health Equity Councils. I'll pass it over to William.
And one moment, just have to actually get my camera on. Good afternoon, everyone. My name is William Marshall, the epidemiologist of health disparities. I work closely with Jasmine Hall, and I'm a part of the Office of Equity and Minority Health. I'll be assisting with any data requests that come from the Health Equity Council, along with data requests from the state of Michigan. And let's see, shall I turn over to Danielle?
Yeah, Lindsay, if you'd like to introduce yourself.
Yeah, absolutely. Thanks, Danielle. My name is Lindsay DeBoer, and I work with MPHI. And you'll be primarily, talking to me. I'll be at your check-ins, but helping to support during questions with invoicing and contracting. Also with some TA requests and the monthly reporting. And so, happy to be here with you all. And I'm going to pass it over to Monique.
Good afternoon, everyone. I am Monique Williamson at MPHI. I work alongside Lindsay with all the support that she mentioned. And you guys may have seen multiple emails from me about different reminders in those check-ins as well. So happy to be here. Should I pass it over to Chaharu? She was doing introduction. Okay.
Hi, everyone. My name is Chiharu Kato. I am a research scientist at Michigan Public Health Institute, the Center for Healthy Community. I will be learning today about all of you, and nice meeting you all. I will pass it on to, do we have Kyla? Maybe not.
Definitely started my introduction muted, so I'm sorry. Hi, my name is Kyra. I'm a research assistant with Michigan Public Health Institute under the Center for Healthy Communities, working with Shaharu, especially on the evaluation portion of this project. I'm trying to see if there's anyone I should pass it to that's from CHC. I'm not sure, I can't see everyone. So I'll just pass it to Olivia. You're the first person I see.
Oh, I was just saying that I think we're going to do each of the organizational introductions when we do the spotlight.
Okay.
I think right now, as we're, I've mentioned in a lot of the one-on-ones that we've had with each of the organizations, we are kind of doing some small evaluation pieces that we're hoping to integrate in a way that's not too burdensome for you all, which means there are poll questions during our Zoom meeting today. So Lindsay, whenever you're ready, we're just going to launch 2 poll questions just to get a sense of where everyone's at. And they should come right up on your screen. So we'll give you a couple minutes to work through those. No right or wrong answers. I think maybe everyone has gotten a chance to do them. Maybe a couple more.
Sorry, I stopped it already, Danielle.
Oh, all right, cool.
So can you see the results?
Yeah, I think the results should pop up for folks to be able to see them. It looks like everyone, for the most part, feels pretty comfortable describing their council's priorities and main activities at this point. And then feel like they know what's expected of them in terms of the requirements and expectations, which is good to hear. All right, so the first thing that we're going to dive a bit into is going to be talking more about power. So that's going to be me. 1 second. So one of the main things to think about is specifically how we see power show up in work that we're doing with collaboratives. So, thinking about a lot of the ways that we talk about power, especially in public health, is at the individual level. We really talk more about kind of different campaigns and things that we can do to really target empowering folks at the individual level. But with this conversation today, we're going to kind of shift our thought and mindset a little bit more to focus on collective power. So personal or individual power does not always address the disparities that we see. And so that's kind of caused this need to arise to focus on collective power. And specifically collective power because that brings together many individuals and organizations so that they can align themselves with a collective goal or vision, so that we can clearly design strategies to address the different systemic barriers that play a role in the disparities that are happening in each of the unique communities that y'all serve. And so collaboratives such as our regional health equity councils are one of the ways that we can foster collective power and bring folks together. So when we're talking about sharing power within our collaboratives, we really need to kind of focus ourselves on a power with framework. So, you know, thinking about how collective power works, it's bringing everyone together. We are all operating almost as a unit, you know, so that means that we need to share those opportunities to lead with one another. We need to think very intentionally about how we're centering community voices. How are we uplifting the voices of those in the community? And sometimes that means creating some community agreements or community charters that can foster the space. So for some councils, that might look like having a list of community agreements, that might look like creating your own council charter so that it has those agreements. It talks more about how you'll deal with any unequal power dynamics and really tries to both elevate the power within those smaller organizations that may not necessarily have lots of capital or lots of kind of those traditional pieces of power that we look at. And then some other ways might be having facilitated conversations. So bringing in a third party for more of the tougher conversations, even if it is at the beginning as you're identifying your strategies, discussing your goals. Sometimes folks find it's beneficial to have someone there who is kind of uninvested. You know, they can really act as your mediator in those spaces. So power shows up in a lot of different ways. And these are just a few types of power that, you know, from working with each of you and listening to how your councils function, I think these might be interesting lenses to kind of focus in on and talk about today. And so that's kind of the social or human capital type of power. So that's who has the power or influence to bring those connections in. So bringing people together who might be able to implement activities, who might be maybe in the past a community organizer or someone who was able to do kind of some advocacy and, you know, localizing folks. So they have those peer-to-peer connections that maybe I don't necessarily have. And so having someone who has that type of power may be able to support your journey in ways that you may not be able to. And so just thinking about those aspects, and it can even come down to the true like human resources aspect of that. So thinking about those that might just be able to gather volunteers or who may have additional staff to work with. So I know some folks have created partnership structures where maybe one of the partners is providing some administrative support for the council. And so that can show up as a way of being able to provide some of that human capital for your collaborative. Then you have positional power. And so positional power is kind of, I think, what a lot of us think of when we're traditionally thinking of power. So the ability to influence different decisions or a particular narrative being shared within the community. And that's usually due to some sort of formal position that they have, whether that's kind of a governmental position or something that's more socially focused. So maybe they aren't, you know, within a governmental structure, but they have a lot of social weight within the community. And so that way they have some positional power, and thinking about kind of other sectors of that as well, maybe some religious or educational positions, school board, things like that. And then lastly, financial power. So the ability to provide those monetary resources, I think that's something that is really a focus, especially as we look down the road, who might be able to provide that monetary support or help facilitate us in reaching the monetary support to keep these efforts and keep this work growing. So you might be wondering why even take the time to really sit and reflect not only in our power, but within the power that your council has and is able to bring. So it really gives us a chance to start a dialogue of what's happening in the community. I think this is a conversational point that can really start to talk about how we can facilitate some processes, eliminate some of those silos and really see who's doing what and kind of connect those dots. It provides a chance for organizations to be really reflective in the power that they bring as well, and how that might impact others. All around, it acts as a point to strengthen our communities, so that we can work to address those systemic roots of disparities. So just taking a bit of inventory, seeing who all of our key players are, and then kind of deciding, oh yes, I definitely want to engage this person, I want to engage them. And I think this person, while they aren't super influential, I think that they would still be very supportive to our vision. So one of the ways that we can do that is with power mapping. And so power mapping is a tool that allows us to reflect. So we look at the different structural aspects that are impacting systemic change in our community, specifically taking a look at the different assets, resources, and influences that are impacting the vision for the council's success. So thinking about kind of the priorities that you've all set forward with each of your councils, and what are the different assets, resources that you would need in order to reach those priorities. Do we have those folks at the table, and how they might be able to influence that process. Once your power map is complete, it's going to provide you a matrix of who's holding that power and influencing your community related to how likely they are to support and oppose that vision. So this can be utilized as a strategy to strengthen your network, target efforts, allocate resources, and work towards building equity within your community. So we're going to talk a little bit about how you would assess power with a power map, and then I'll kind of show in a kind of the general layout. So when it comes to assessing power with your power map, you want to consider your community, all of the key players. So who is holding any of those particular forms of power that we talked about? How is that impacting the success of the council and their ability to move forward? And then placing those folks on the map accordingly. So when it comes to, it's a nice grid matrix. And so thinking about, okay, is this person very supportive of our vision or our goal? Or would they kind of oppose or not support that? And then what types of influence does that person have? So if that person's very influential or less influential, just thinking about how they would fall within this quadrant matrix. And it kind of gives you a chance to really target your efforts there. You know, you have those that are the most influential and that will really strongly support that kind of fall within this first quadrant. Excuse me. And those, I think, personally are going to be the folks that may be the low-hanging fruit. Those sometimes are very easy to have pop into our mind. And then we have those that might be least influential but strongly support. And those folks can kind of act as, in some ways, a bit of facilitators, right? So they are really acting as an advocate for the work that you are doing, but might not necessarily individually have lots of influence, but they may have the network that can help to facilitate and bring others in to support your work, which can kind of, balance out some of the oppositional viewpoints that may be coming to light. I know that for some communities, talking deeply about systemic racism, disparities, equity, can create this very clear oppositional divide. So thinking about some of those folks that are really supporting your vision and how you might be able to leverage the networks they have to expand your growth, as well as to be able to move efforts forward in a succinct way that hopefully avoids some of those oppositional pieces. Is it not moving? So if you all are interested in learning more about power, how to, dive into or assess your power, of course, we have, I think, a couple extra minutes here if you want to talk a little bit more about it. Feel free to raise your hand or come off mute. Otherwise, definitely placing a TA request, and then we can work to find out what makes the most sense in terms of how we can support you all. So if anyone has questions right now, feel free. I think I somehow went like 3 minutes fast, so get it all. It's okay.
I have my hand up. I didn't know if you saw it.
Oh, yes, I did. Thank you, Joyce.
Listen, the question I want to ask you, this is all great information. I was trying to see if you were going to give us some examples of how this could apply. For instance, the power mapping that you just discussed. Can you give us maybe an example of some community who has done this kind of mapping and the impact it might have had? And secondarily, let me go back to my other page where I took some notes. Hold on 1 second.
Yeah.
It was about defining the power and maybe show. Well, I guess it's related to the grid. So how the benefits of the power mapping, and maybe some organization who has actually applied that principle and talk about how that impacted their ability to deliver services in an equitable way, in a better way.
Great questions. So I think your first question was around who I've done power mapping with in the past and how that's helped them. I personally have not utilized power mapping. This section of the TA I identified just through kind of conversations that I've had with you all, whether that is around kind of designing your vision, identifying partners to engage, as well as ways and strategies to deal with folks who may not be big fans of our vision. Unfortunately, things around racism and disparities, as well as COVID, have been very polarizing for communities. And so I kind of wanted to talk about this as a way for us to really think about not just dwelling on those that may be oppositional to our visions, but also looking at who our partners are and kind of to start those conversations of like, what are the pieces that folks are bringing to the table? So, you know, yes, you can put people on this matrix, but also going back and thinking about, bear with me, oops, the types of power that those folks are bringing so that you can leverage that power that they're bringing, especially with the types of topics that we're touching on. It's very important to find root and find strength within that power in order to be successful, right? And I think that leads right into your second question. So your second question was around how to utilize this and like when are the best situations to utilize this. I think this is early on, I always think that's a great time to take a look at that, especially because as you're bringing in folks to join the council, as the council is identifying activities, this may be a good exercise to just look at, okay, we have some folks who are bringing in some social capital. We have some folks that maybe will be able to support financially. You know, you might have another partner who may be able to provide some of that support or may have the knowledge around seeking out additional resources as you look at sustainability. So it can be used not just as a tool to kind of look at and dwell on both like the supporting and the not supporting or unsupportive factors, but to also really take inventory of what you all are doing.
But I think, Dylan, you've hit it on the head. I think that these HECs is an opportunity to really do this power analysis, because you think about it, as you were talking about social and human capital power, positional power, and financial power, I began to list the people around our table who fit under the various categories. I began to do that. And one of the things we're trying to do is equalize the table. So those who may not have the financial power and some who not feel they have the skills, we begin to lift them up so they can have the ability to speak at the table, and what they recommend or suggest will have merit, and we will take it under strong consideration to show that their input is valuable. So I think what we're doing is indirectly doing what you're recommending. I don't know if we necessarily formally done it. I think as you were speaking, I began to list these people. And so I think we're actually doing it. So I think we're implementing it indirectly right now. That's just my point of view.
Huh. I think that's
Danielle,
great to hear. No, go ahead, Acton.
I just want to acknowledge that Manu put in the chat that the American Heart Association facilitates power mapping exercises. And then we can definitely provide some tools for folks that are interested.
Yes, we definitely can. And we'll be, of course, sharing these slides. And then as always, you can always ask more questions. I think we have time for maybe like one more question if someone has a burning question. Otherwise, we set aside time for all the questions in the world at the end. Yeah, that is a great question, Lindsay. We have a TA form, and then there is also space in the monthly form as well. MPHI will be going into a little bit of detail about submitting TA requests. We made some updates to the form. Well, we got you. All right. I think that's it for me.
So at this time, we are going to take a 5-minute break. You can utilize this time to grab a drink of water, stretch your legs, and we will return at 1:40. So I'll see you all soon and enjoy your break. All. So now we will move to the next slide, which will be our BBO spotlight. And we will start with the City of Detroit Moses.
So do we just talk?
Yeah.
Oh,
So if you want to introduce yourself and your organization, and then
okay.
take it away. You get about 2 to 3 minutes.
Okay, can I have my team get on camera? I think everybody's on. A couple of them are out of the country. One's coming back today, and so I'm missing 2. So I have, my name is Pancella Hardaway. I'm director of Moses in Detroit. And I will ask if Chandra and Andrea, I think those are 2 that are on right now, introduce themselves.
Good afternoon, everyone. Chandra McMillian. My company is the McMillian Group, and I'm the program manager for this initiative.
Hi, I'm Andrea Gutierrez. I just started working with Moses a couple months ago as their voter protection organizer, and now I'll be helping with the health equity part of our organization.
Yeah. Thank you. And then we have a couple of others. So Tressa Libra, which is with Mishwa, and Maya Campbell, who's also with Mishwa, and Elon Gifford, who is with Birth Detroit. And oh, I'm sorry, I'm looking, the screen is here, but I got it flipped backwards, so I'm looking this way. And Adora Ezeki, who's with the City of Detroit, who was part of the current team. And so I will say so far, and I feel free, Chandra, to weigh in as well. We have developed, we had our first partner recruitment presentation. And I forget the number of organizations. I put that in there as a question mark to Maya, but I think we had about over 13 organizations who were a part of that conversation and who will be recommending people for our council. And we develop a recruitment process and somewhat of a temporary timeline until we actually seat the first council. We actually have developed a website that anything that's being shared with the council or any work that's being done is made public to the broader public, so anyone can have access to any resources that go through the council in terms of their time and their term as council members. So any information, documentation, trainings, etc., is made readily available for anyone to access. We wanted to make sure that was shared. We actually have a logo designed. We're still working on the names of the council. We have a list of brainstorm names. We just haven't agreed upon which one we wanted. And we're having a recruitment, did I write this twice?
Candidate information session.
Yeah, I think I wrote that wrong. It's information session. So the information session will be December 1st. So that'll be the first conversation with all of we have probably over 15, probably more than that actually.
Actually,
people
we had
interested
22 people on our call.
Okay, we have, so 22, thank you. We have 22
And then
people
there's
on the-
additional names, more than that. So we'll probably end up with at least about 30 or so candidates.
Yes, yes. So, and we still have people who were not even on the session, we're still sending their people in terms of recommendations who they want on the council. So that's pretty exciting. So we'll have that first information session on December 1st.
You have
Let's see.
1 minute left of your time.
Okay. And then the makeup of our council, we're targeting Detroit residents only. We looked at, because we had so many different organizations that who all have a health equity platform that they have a lot to contribute. So there we're allowing for 50% of those to be staff from those organizations who are still volunteer time, as well as community members. So 50-50, because they bring an expertise. And then we also want to bring community members, so there can be some really deep cross sharing and experiences and capacity building. And they all represent various sectors of health equity. Okay, wait, oh, this is the next slide. Wait, this is somebody else. Wait, what is this? Oh, this is a continuation. Well, my time is up. Here's the slide.
All right. In Genesee.
Hi, everyone. My name is Nicole Smith Anderson. I'm with the Greater Flint Health Coalition, and we're the backbone organization for this council. Also on the phone, I believe Ashley is still there, and she is part of the Power Initiative, and we've been working very, very closely with them to help get this council up and running. And I will say we're so lucky to have them as a key partner. Just kind of a high level overview. One of the key priorities that we really worked on was making sure that we had a diverse, equitable, and inclusive council. So we spent a lot of time just reviewing individuals that were nominated to participate to make sure that we had a really good selection, diverse selection, and representative of our community. The other priority that we've really tried to work towards is completing a request for a proposal. So we want to push out as much money into the community as possible. We also want it to be as equitable, but then also have it be a skill building opportunity and a capacity building opportunity. And so with that, Ashley's group in particular has developed some TA grant opportunities to make sure that not only are we pushing out an RFP, but there's also opportunities to get support with it. And we've come up with some, I think, cool things that will help people along in the process. We've also had the ability to look at some SDOH data specific to COVID. We're lucky here that we have a lot of access to data to review. Our makeup, we kind of just looked at our sectors. So residents, we're big proponents locally of having youth as well as seniors, just because we think they're critically important. Also making sure we have faith representatives, neighborhood groups, CBOs, social services, nonprofits, healthcare, and then residents. Priorities obviously is really pushing out those dollars to community-based organizations, but we've had a lot of members that have expressed interest in kind of identifying those non-traditional COVID-19 things, right? So we've had lots of conversations around long COVID and, you know, what other education and opportunities do we have? And I think our community partners are really excited to perhaps, you know, create something new and different. Also beginning to look at current systems and what works and what doesn't. And then our priority populations are African-American, Hispanic primarily, but we have a pretty significant Arabic population in Genesee County. So we want to make sure that they're in the fold as well. Ashley, did I miss anything?
Sounds great.
All right, thank you.
All right, you guys actually have 45 seconds left if you want to use your last 45 seconds.
I will just say this. I think this is really cool. It's fun to see everyone's various process for this and the things that they're prioritizing and working on, just because we do have what I perceive as like a good amount of flexibility to implement these. And so it's kind of fun to see what everyone's doing and see the different variations. I don't need any more time.
And we're gonna pass it on to the Ingham region.
Hi, everybody. Can you hear me okay?
Yep, we can hear you, Dana.
Hi, my name is Dana Watson. I'm here in Ingham County, Lansing, Michigan area. And Jason Blanks is also on the call. And Jason, I think I'm going to take the first two and then hand the second two off to you, if that works.
Sure.
So our key activities are we've selected and seated our 12 Health Equity Council members. We created a request for proposal process for mini grant applications, seeking mini grant applicants, and we released that to the community and residents. And that mini grant application was open October 1st through October 31st. And so we, as of early this week, or like Monday, selected the 15 awardees, totaling $125,000 that will be distributed to those 15 awardees. Our Health Equity Council members, the 12 of them, had a rubric scoring system to point out the what they thought each, how each person that applied would get points, and then we based it on that. And so what my point is that we really left the decision to them as far as where the dollars were going to go. We had approximately 30 people apply for the mini grant application. Our council, Health Equity Council, is made up of 6 African Americans, or 6 people that identify as Black or African, 1 person identified as Mexican, 2 people that identify as Asian American, 1 Native American, and 2 people that identify as white. And I'll go ahead and pass it on to you now, Jason, and please feel free to add in whatever you'd like to.
Sure. Our priorities for our project is, of course, funding 15 mini grant projects to address COVID-19 disparities in historically marginalized communities. One of the things that we really wanted to do was ensure that we had resident and community voice at the table. So we went out of our way to make sure that we engage with as many partners as possible going into the community, and really just trying to hear their thoughts, our partners' thoughts around COVID-19 and how that had affected the community. Going back to the grant, we held several mini grant sessions where we went in, once again, into the community to share that information with the public, just to really, to be honest, to really make sure that everyone is aware of what's going on. Priority populations, of course, our BIPOC community. So I really didn't have a whole lot. I apologize, everyone.
You did good. You got 30 seconds. Anything else you want to share in 30 seconds, Jason?
No, thank you for the opportunity. And I'm learning so much about hearing what our partners are, meaning you all, are doing in the community. I applaud all of your work. And thank you to the state of Michigan and MPHI.
Thank you, Jason. And next up, we will have Kent County.
Hello, everybody. My name is Brian Hartle from the Kent County Health Department, and I'll allow our other team members to introduce themselves quickly. So starting with Janie.
Hi, everyone. My name is Janie. I'm a public health program supervisor at Kent. I've been there about 4 years, and I'm super excited about this project. I will pass it over to Olivia.
Hi, everyone. My name is Olivia Pena. I work at Kent County Health Department as a health educator and health equity coordinator. And I'm really excited about this project, and it's good to meet all of you.
Go ahead, Tracy.
Here we go. Make sure my button works. Hi, Tracy Milanowski-Fauner, public health educator at the Health Department in Kent County. And yeah, I just want to reiterate that this is a fantastic opportunity just to see what everybody's doing out in community. So thanks for that opportunity.
And finally, Leslie Griswold.
Hi, everyone. My name is Leslie Griswold. I'm the grant administrator at Kent County Health Department.
So this is just a basic structure of our Health Equity Council. We have a community voice group that really is the meat of what we're doing here. That group comes together to provide their voice on health priorities and identify strategies and solutions and look for implementation strategies for those key priorities. And we have 12 different community-based organizations who are part of the council, representing all of the racial ethnic populations that make up Kent County, in addition to disability community, LGBTQ+, the aging community, and others. You can see them there. We also have community members who are part of it, and we really focus that on the geographic areas of our community who have high social vulnerability index ratings from the CDC. So we have, we're hoping for 10 people to join from the community. Right now we have 7 or 8, and so we're still looking for a few members of the community. So we've already held 2 meetings of the community voice group. October 26th was our first one. We have hired a facilitator who is fantastic. Her name is Shaquana Gordon. She kind of gave a brief overview of health equity and equality, kind of defined safe and brave spaces and what we want to get out of these meetings. And then we started identifying standards of engagement. So people gave their input on that. And then in the second meeting that we held on November 9th, we kind of just gave a basic overview of data 101, what it is, how it's used, some basic information around reading charts and graphs and tables and things like that. And then we used the standards of engagement ideas that came from the first meeting to really focus on a consensus building activity to talk about how we will do consensus building in our future meetings when we kind of identify the strategies and where funding will go in the future. So that was a great ending to that meeting to just get people thinking about how consensus will work. So that we'll have meetings in December that will focus more on data and identification of strategies. Hopefully we'll have the strategies identified by the end of the year. And then what our goal is to bring together another group, the system level group that brings together healthcare partners and other community stakeholders from philanthropic organizations, government, and other nonprofits to come together. Those are the individuals or the organizations that kind of have the power, as Danielle was talking about, the financial power to bring resources and investments and programs to the needs of the community that are identified in those community voice groups. And so that's the plan so far. So we have that kind of laid out through January to bring the community voice group together several more times, and then that systems level group at the end of January. And hopefully we'll have things ready to go to implement funding to our local organizations to carry out the strategies and solutions that are identified by our team here. I felt like I went really fast, but hopefully I got it in time.
That was perfect. You were like perfect on the money, Brian. Great job.
All right, excellent. Thanks so much.
Thank you, Brian. Next up, we have Macomb County.
Hi, everyone. Thanks for having us here today. My name is Michelle Weemhoff. I'm the Macomb Health Equity Council Coordinator. And I'm also joined today by Khadijah Walker-Fobbs, who is our Chief Strategy Officer at the Judson Center, which is the backbone organization. And Eva, I'm going to let you introduce yourself with your last name in a moment, from the Practice Transformation Institute, who's coordinating one of our most fundamental parts of our grant, which is our community health worker training. So we are really excited that we've hit the ground running in Macomb County. We've already had 3 meetings, as said too, but we just had another one this week. We voted on a logo, which you can see on the slide. We're in the process of creating our webpage, and we've already created materials that have our logo on it as well. We are also doing mini grants. So far, we've approved 18, and we just allocated some more funding because we had other organizations that we wanted to support. So we really are pushing that money out to the communities, and specifically to organizations that are really addressing the populations that have been marginalized, and the mini grants. Well, I'll talk about that in a minute. The mini grant process has really been community driven. So council members are the ones who are making all the decisions about the mini grants. And our council includes 7 individual members as well as 9 organizations that represent the diversity of Macomb County. We are focusing our priority populations on all 5 of the target populations, so African American, Arab American, Asian, Latinx, and Native Indigenous, and almost all of those groups, except for Indigenous so far, are represented on the council. I think we have one more slide. I did want to give a chance either to Khadijah, if you wanted to say a few words, but especially to Eva, who's coordinating this incredible community health worker training, which is part of our sustainability model. And Eva, if you have a moment, I'd love you to talk about this work.
So thank you. We brought in Practice Transformation Institute into the coalition because we thought we needed to move beyond just the 6 months and come up with some method for spreading and sustainability. So the community health worker learning collaborative actually rolls out on December the 15th. We extended the date. It is expected that the majority of the community organizations that are a part of this group will nominate and submit the names of individuals who would serve as community health workers within their own community organizations. But what we're doing is we're bringing in 6 patient-centered medical homes so that we can cross-pollinate and one can learn from the other as to what that whole person care might look like. And so we're very excited about that, and like to thank the CDC and MDHHS for allowing this type of activity to really take root and grow.
Thank you so much, Eva. Khadijah, did you have anything you wanted to add?
Khadijah, you've got about 45 seconds.
Okay, I'll talk fast. So just that, like Eva said, our sustainability model is because these community health workers are part of our funding and they're part of the council organizations. They will be in place after this grant ends and will continue the work. And so they'll take the training from PTI, use it, still work in those vulnerable communities and be sustained within the organizations that sit at the table. So we think that's extremely key. So I think I made it in 45 seconds. Thank you.
I think you did.
You did, with 10 seconds to spare.
I will just add that of the mini grants, part of that is going to the community health worker training, and the other part is going to health events around the community, so the workers can actually go out and collect that data and hear directly from community members what they need, what their health needs are, and what their barriers are, so we can try to break those down. Thank you.
Great use of those 10 seconds, Michelle. Next up, we have Muskegon County.
Hello, everyone. My name is Shoni Blake. I will be the project coordinator for Muskegon County. And I just want to say for Macomb County, you guys are killing it. I do have a background as community health worker, serving with our hospital system for a long time. So just kudos to you guys for continued investment into community health worker field, because it is very difficult to get funding for those. For Muskegon County, I would say we have had three meetings, I believe, for our equity council. Primarily, I want to focus on making sure that we had our memorandum of understanding signed and our NDA. That was something that was very important for the council, and sharing data and sharing information amongst the group. They have agreed that the agreement was very important to hold higher standards for the council and sharing data and sharing information. So we had that done at our last meeting. We agreed on a communication platform for all the members to use to make it easier for us to talk and come to agreements on things. Slack was the application that we chose, which is I would say like a souped up Teams is a very cool application if you guys get a chance to check it out. And then we also have ongoing discussion with mission and vision development that should be finished at our next meeting. And we have agreed on our budget priorities and our where we would like those funds to go towards CBO capacity building. The council membership is a good mixture. I would say right now we have 8 core members and 2 supporting members. The makeup is grassroots. We have small business, residents, and we also have some tribal representation there. So that helps. So we have a wide range, and we will continue to try to recruit our residents in so that they have a say so in where those dollars, how those dollars are spent in the community. Priorities for our next meeting is going to be finishing up our action plan development. That's going to be very important for me, just so that we can identify our priorities. We do have 3 or 4 CBOs at the table, so we have a good amount of cross sector collaboration. It's kind of hard determining what the goals and objectives will be, just because we have a lot of powerhouses at the table, but hopefully we can get that addressed with our next meeting. We have prioritized capacity and what looks like training development for CBOs. So we identified 2 training opportunities right now that they could take advantage of, myself included, and it's pretty much open to the community also. So that will be our GBSU, which is our foundations data class that will be available to participate with December, I believe, of 2022, going into January of 2023. And then we have successfully signed up 3 of our council members in our GRCC grant writing training class, which is going to be a foundational staple for us when determining how to finalize our letter of intent and how to get those monies out for the many grant opportunities. I have taken a lot of notes today, and the thing that we're going to be working on in our next visit is going to be website development and logo development, which is going to be a tough cookie for me just because we haven't discussed what that will look like, but hopefully that development comes once we are able to collectively meet again and have that discussion.
You are right exactly at time. Perfect.
And I forgot to introduce, I'm sorry, my supervisor, Samantha Cornell. She's been very, very helpful in facilitating me with my many questions. So I just wanted to say thank you. She's on the presentation today, and I grab her and talk to her and bounce ideas off her head every chance I get. So I'm thankful to have a good leader.
That's beautiful. Thank you so much. And I would like to pass it on to the Oakland County Health Division.
Hi, everyone. I'm Lindsay Terhar from Oakland County Health Division, and my supervisor, Carrie Rybar, is also on the call and helping with this grant currently. Right now, we did hit some delays with our acceptance of the grant due to the county's grant approval process, but we have made some progress and we actually expect full approval of that within this week. So right now, our key activities have been kind of behind the scenes. So identifying additional partners beyond the initial CBOs that signed on for the grant application. So we've been working with them to identify additional partners. We've been thinking about a call for community resident applicants as well. And then we've also been doing some of the less glamorous administrative tasks like finding a project coordinator and starting to work on contracts behind the scenes. So those are our current activities, kind of laying the groundwork so we can hit the ground running once we have full approval. Right now, we have 3 council member organizations on board: Arab American and Chaldean Council, Centro, and the Pontiac Community Foundation. And we have, like I said, been working on identifying additional partners. We will have a goal of no more than 10 organization members and at least 5 community resident members. And we are hoping that those both residents and community organization members will be representative of our priority populations, which you can see on the slide here. We've identified those populations that we know of disparities in COVID outcomes in Oakland County, and or suspect disparities. So for example, folks of Middle Eastern and North African descent, there's very good data on that, unfortunately, but we have reason to suspect that some disparities exist. And then along with that, with our priority populations, we're trying to pay special attention to intersecting identities that might put people at even higher risk of inequity within the county. And once we have our group together, our priorities are really going to revolve around collecting data on social determinant of health impacts of COVID-19 on our priority populations. And that information will be used along with some other data collection methods, including focus groups, to help develop our strategic plan that the council will be working on. And then in the meantime, as we're doing these SDOH screeners, it also allows us to immediately link residents to existing supportive services. So we're trying to provide some immediate assistance and also help inform some mid and long-term strategic goals that'll help eliminate those gaps and increase equity. And that's all I've got.
All right, there's a question for you in the chat. You have 30 seconds. So there's a question in the chat that says, what tool is being used to collect SDOH data and where will that data be housed?
Yeah, so we have an existing SDOH screener that we use that's based on some other screeners. I'm happy to share if folks would like. We will probably still do one final review and run through with our council before we launch that. So I don't want to say it's final because our council hasn't met yet to review. So that is almost finalized, in the works. But yeah, it will be captured by community health workers who will be doing SDOH screening. So we will be providing funding to our CBOs to either pay a staff person to do this or hire a part-time community health worker. That's what we're using the grant primarily for.
And to clarify, the screener that we're currently using is really similar or essentially the one that was developed during the state innovation model. So I know it's one that's used in a lot of different parts of Michigan, and we're hopeful that, you know, that everyone will be good with continuing to use that moving forward.
Thank you so much, Oakland County, for your overview, and we're going to pass it on to Ottawa County.
Hi, everyone. My name is Sandra Lake, and I am joined here with Angela Maxwell. Sorry, I'm blurry. Hold on. You don't get to see Angela. Together, we are helping coordinate this initiative along with Heather Alberta, who's unable to join us today. But similar to Oakland County, we faced a few challenges, to say the least, to get this up and running, primarily related to just the political environment that we are living in. So in August, we worked hard to just get the funds approved and our budget amended. And then in September, we spent quite a bit of time doing really targeted outreach, particularly to our Latinx community. And so we spent some dollars on advertising and held an interview with a Spanish media radio station to solicit community members to sit on the board. And then October, we worked really hard to find Angela, and she actually, today is her first day. So welcome to her. And so we've been just doing some of the behind the scenes administrative stuff, interviewing all the nominations that came in for our council, and then meeting with community organizations to be really strategic and I guess mindful of who's at the table when we think about power, both positional, financial, and influential. So that being said, our first meeting is scheduled for December 1, and we right now, this slide is a little bit out to date, but we have 7 community members. So we reached our goal because we wanted to do 5. We have 7, and then we have 7 agency representatives, primarily from CBO, grassroots community orgs in different sectors, whether it's social service or health. The communities or the individuals represented on the council are primarily BIPOC, larger percentage, sorry, identify as Latino, but we also have Black, Asian American, and then one individual who is hard of hearing. Then what else can I tell you? Once we establish the council, the first meeting is really slated to just, I know Adora's on the call, but we're gonna just do some level setting, talk about integrating the head and the heart and really identify, talk about what it is that we're trying to achieve together, because when we throw out words like health equity or SDOH, I think people have different understandings of that. So we're just gonna level set, and then we're gonna, session 2 and 3 will primarily focus on doing a SWOT analysis and strategic planning. And then after the start of the year, that'll help us identify the priorities and the funding that we wanna distribute for the rest of the grant project. So I think I highlighted everything. One other thing that was kind of fun that we got to do is we did attend Just Lead in Detroit, and that was really helpful for just giving us some tools and language that we were able to bring back for the council, and then also just internally within our organization. So building capacity that way as well. Yeah, I think that's it. Similar to everyone else working on MOAs, administrative stuff, contracts. But that's pretty much it.
Welcome, Angela. Happy first day. And also I'm thrilled because I love a SWOT analysis.
Yeah.
Thank you, Ottawa County, for your overview. Next up, we have Wayne County with Dabo.
Hi, everybody. Minu Jones here with Detroit Association of Black Organizations. Just real quick, some of our key activities to date have been to recruit members to participate in the council. We currently have 10, and they are comprised of a faith base who is Kenneth Giles. He chairs the Detroit Wayne. He chairs our Equity Council. Health, we have mental health and physical health with Premier Quality Health and Linda Little. We also have schools at the table, Mackenzie Noble. We have a civic leader. SUD is Cara Thomas from Detroit Wayne Integrated Health. We have business at the table, media. Morrow and Associates is our media partner. And then we also have volunteers who are really grassroots level people that do things already, like property tax assistance. And we have a parent from Changing Lives and Staying Sober. Our priority population, of course, are people who live in Wayne County under the SES scale. And specifically, we like to target those who are unemployed, don't have a high school diploma, single parents with children under 18 and no vehicle. And, that data really came out of looking at the 2019 needs assessment from Henry Ford Health Systems, I guess, prior to the pandemic. But we know that these are our most vulnerable populations within Wayne County. Next slide. Oh, I see it's up. Right. So our coalition, I keep calling the coalition, our council, has met 3 times, and we basically identified 3 priorities. We use the strategic prevention framework model. Our end goal, of course, is to have the strategic plan, but really right now we've been looking at assessing the current readiness of community-based facilities to possibly serve as community health resource centers, and their ability to respond to public health crisis. One of the things that we learned during COVID was that there were a lot of organizations that were able to step up and receive minimal training to do things like provide food, do screenings, provide referrals. So we want to really capitalize off of those assets and then go to priority 2, which is to build their capacity with technical assistance and trainings to really build out their infrastructure and capacity, so that if we are, faced with another pandemic or challenge, that we have more capacity and readiness to address those issues. And then priority 3 is really to develop our COVID-19 prevention and community public health preparedness plan with the goal of increasing priority population to those critical resources that were highlighted because of the pandemic. In our communities, transportation is a huge issue. If you look at that needs assessment, 40% of Detroiters alone are without transportation. We're dealing with food deserts, and communication was an issue. So we want to make sure that we really look at those issues, and then through our mini grant process, build the capacity of those organizations to be able to better respond.
You are right at time, but there is a question in the chat that says, do you mind sharing the name of the strategic process you used?
Oh, yes. It's the SAMHSA, Substance Abuse and Mental Health Services Administration Strategic Prevention Framework Model. I will throw it in the chat.
Thank you.
Thank you so much, Manu. And now we're going to pass it over to Washtenaw County Health Department.
Good afternoon, everyone. Can everyone hear me okay? Perfect. So my name is Chuck Wilson, and I'm from the Washtenaw County Health Department, and I'm joined by two of my colleagues, Ruth Kraut, who's our Deputy Health Officer, and Sandra James, who is our grant coordinator. So just going through this slide, as you can see where we are, member recruitment. Right now, we have 10 folks who are representing our council, and we are in the process of adding 5 to 6 more people to our Health Equity Council. We're also focusing on DEI training, or diversity, equity, and inclusion training. We thought that that would be important for our health equity, our council members, in that many of them may not even be familiar with DEI outside of their lived experiences. And so we wanted to collectively come on to the same page, or be on the same page as we get ready to operationalize the grant. The next bullet point, council member makeup. We have 4 grassroots organizations, including youth, and then also, as I said before, we're going to add some more folks to get to that magic number of 15 or 16 council members. So our priority populations have been Black, or are Black, African American, and Latino residents within the 48198 zip code. And just to give everyone an idea of where that is, that's on the eastern side of Washtenaw County. And that's where we saw the highest, proportionately the highest instances of COVID, also hospitalizations, and unfortunately death rates. Our priorities during this reporting period have been vetting additional members by current council members. And so we initially had three grant partners who signed letters of support, who are also represented or are part of the Health Equity Council. And so we sent out a press release to solicit other council members, that those numbers fall within the 5 or 6 additional ones that we're still taking a look at, or that we're looking to add. And we had the opportunity to really listen to our council, our grant partners, to help us sort of sift through and decide who we thought would be the best fit. The council has made community-driven decisions, for example, meeting times and places, hybrid or virtual. And so in order for our council members to get used to this community-driven process, we've actually put all of the decisions are being made by the council. And sometimes that has, we're noticing that they're really deferring to us to make those decisions, and then we have to say, no, it's a community-driven decision, and so the council has to make the decision. So that's been an interesting dynamic that I think that our council members are still getting accustomed to. We've prioritized a couple of health equity trainings. I think I mentioned that for our Health Equity Council members, and we're consulting now with 2 trained facilitators, one on a statewide level, so that one who can give us a higher level for sort of statewide regional level view of DEI. And then we've got a local person who really has a good idea and has her finger on the pulse of DEI here locally in Washtenaw County, which we think will be helpful as well. And
you
so
are right about
I'm right on time. I was stopping after. So
thank you.
Thank you, Washtenaw County. And next up is Saginaw.
Thank you so much. I'm Joyce Seals, and I am the coordinator for the Health Equity Council here in Saginaw County. And just came on the job, I think, on the 31st of August I started. And we've had now 5 meetings with our council. Our Saginaw County had convened a group for some previous activities. And so as we started the council, we had a small foundation of individuals, but we've added individuals to that. And so our council makeup, we have community organizations, we have people like the NAACP, our Mexican American Council, we have the Community Foundation, we have Great Lakes Pride, and we have many others. We have our health organizations, so St. Mary's Hospital, we have Great Lakes Bay, we have Central Michigan University's College of Education, College of Medicine, and their clinic is part of our team. And of course, we have health department people, mental health, and education. I was really proud that we have Saginaw Valley State University is working with us on our project. One of our people is working very closely to help us to organize and get things moving properly. And we have a lot of cultural organizations too, like our Mexican American Council and so forth. We also have rural Native representatives and Latinx, we said, Muslim representation as well. And we've identified these groups as the ones that we want to work with, because as we look at the response of the, unfortunately, disparate responses during the COVID pandemic, these were the areas where people were disenfranchised. A lot of them didn't want to be involved with the COVID response in getting their vaccinations. And as we looked at those numbers, then we identified these populations as our priority. Right now, we're in the process of doing COVID tests and mask giveaways. That's part of our grant, says that we need to do that. And so we've given quite a few of our organizations are doing mask giveaways. One of the things I'm really proud of that Dr. Pruitt did a wonderful video, because a lot of the members said, you know what, you're giving us these test kits, but people really don't know how to use them. And so we created a video that we're showing on our YouTube, as well as our Facebook and other places, so that people, once they get the test kit, will know how to use it. And we have had a really great response to that. And so we're giving those out. Our big effort is planning these focus groups, and we're doing it with all our priority population that you see on this group. We're doing at least 2 per session, and we're going to have trained facilitators. We're having facilitation training later on this month in the first part of December, and we want to start rolling these focus groups out. We're right now in the process of developing the questions on all the protocols to develop to be able to have these focus groups. And the idea that the information from these focus groups will inform our decisions, hopefully, to roll out our mini grants, because we want to be able to identify gaps in service as it tells us to existing or develop new mitigation and prevention resources based on the information that we're going to gather from these focus groups. I'm excited about this focus group process. In the middle of that, we're still planning. We're planning our mini grants. We just finally got those protocols and all of that to develop. We'll be rolling that out at the first part of December. And so we will be letting our equity group come and see that information, and they will be supportive, because we do use a consensus process to make our decisions. And so I'm just thinking, I've got Dr. Pruitt is here with me in my office. She's waving. And also Tracy Metcalf is here, who is we call her our chick for Saginaw County, and she's the health improvement. I think she is on as well with me. Tracy, do we need to add anything to that very quickly?
No, you did good, Joyce.
Okay, very good. So I wanted to give you a quick overview. I know you had 3 minutes. Any questions about what I've said at all?
No, we're at time. So thank you, Joyce.
Yes, thank you, Joyce. Thank you, Saginaw, and to all of our BBOs who gave us an overview during the BBO Spotlight. Now I will pass it over to Lindsay and Monique with the MPHI updates.
Thank you, Bree. Next slide, please. Hi, so really quickly, I know we are short for time, but I just wanted to remind everyone that you will be getting those emails from me more so every 2 months about setting up those new polls, just to make sure that we can get those check-ins scheduled. If you do have bi-monthly, just making sure that you fill out those check-ins according to what your preference is. If you are monthly, just making sure that you also fill out those check-ins for that month. Of course, with those 1-hour meetings, we will go over all admin updates, council updates, and also just general ways that we can assist in brainstorming with your councils. My contact information is right there. If you guys have any questions over the check-ins, feel free to reach out to me at that email address. And quickly again, for our TA requests, those are located in your monthly reporting forms that you guys are filling out every month. There's a link for you guys to fill out those forms. We will be updating the forms to just get more of a level of detail to make sure we are capturing those requests as much as possible. So pretty much what type of request what type of TA you're requesting, I'm sorry. And then also just what TA is needed for your council. So just look out for that link in your reporting form. And if you have any questions, you can always reach out to myself and Lindsay as well. And I'll pass it over to Lindsay to go over invoicing and reporting.
Thanks, Monique. So just a reminder with the invoices, most of you did submit your invoices and that's awesome. So thank you so much. They are due the 15th of each month unless we've already talked and have a different schedule approved. It is going to shift a little bit. So I will need to receive the invoices as well as Kristen. So make sure that you are including me on that email as well when you send them in, and that you are providing that high level summary of activities, as well as, you know, making sure that the activities do align with the budget that was approved. So we just really want to make sure that it all is aligned and that there aren't any issues there. And then for the monthly reporting, just a reminder that you guys have all been doing this so far. There are a few organizations that do still need to complete their report for this month, but it is due by the 10th of every month. And, you know, the purpose is to track all the activities of the council, the activities that you're providing in terms of mini grants. And we do really want to emphasize that we want to report activities that are just directly funded by this grant. So if, let's say your health department is doing other work, but it's not being funded directly by these funds with the councils, please don't include that. So we just want to really hone in and focus on the work that your councils are working on. Please discuss any successes, barriers, and challenges. And just to let you know, there will be a little bit of changes to the reporting form, but nothing too major. So if you do see that and you do have any questions, just reach out to me or Monique and be able to help you and walk you through it as well. And the last slide is just a little bit of guidance about the types of partnerships. I know that this can be a little confusing, so as you guys are walking through it, if you're like, you know what, I don't really know how to count this, please reach out to me. But with a new partnership, and this is the definitions that we were provided, meaning it's completely new, you've never worked with them before, you count them the first time, but the next time you don't count them again. So every time they're new, you just count them the very first time you've established that partnership. An existing partnership really means that it existed before this project. So you count them the first time that you report it, but then you don't count them again unless something expands in their scope of work. And then for an expanded partnership, it means that you have changed the way in which you work with them. And so if they've expanded, again, the first time you count them, but in subsequent reports, you don't have to count them again. So we just really want that documentation the first time it happens. And this may look like your partnership numbers might not always be increasing every single time, and that's totally okay. We will send this all out in an email too. I know I'm going really quickly and that's fine, but feel free to reach out to me with questions. We will send out guidance because I know it is a little confusing. I also want to push out one poll. I really appreciate your time here. We just want to know a little bit. You've heard some information about power mapping and how that can be used in your council. And we really want to hear if you feel like you might use that with your health equity council, like how useful, if you feel like that's something that you could use and bring back. So that's all, Danielle. I'm going to turn it back over to you. Thank you.
All right. I know that we are totally